You are home alone and you walk into your backyard to find your child face down in the pool. What do you do? Every parent should know how and when to do CPR. When administered correctly, CPR can save a child or adult's life by restoring breathing or circulation until advanced life support can be given by a healthcare provider. Everyone at some point in their lives may be given a situation where they have to administer CPR. CPR may be necessary during many different emergencies, including accidents, near drownings, suffocations, poisoning, smoke inhalation, electrocution injuries, and sudden infant death syndrome. If faced with a certain situation, you should save a life by understanding how and when to use CPR. According to hearthub.org, CPR or cardiopulmonary resuscitation is a combination of rescue breathing, mouth-to-mouth resuscitation, and chest compressions. If someone isn't breathing or circulating blood adequately, CPR can restore circulation of oxygen-rich blood to the brain. Without oxygen, permanent blood damage or death can occur in less than 8 minutes. Reading about CPR and learning what is needed will give you a basic understanding of the concept and procedure, which is strongly recommended to learn the details of how and when by taking a course. If CPR is needed, using the correct technique will give someone the best chance of survival and recovery. CPR is the most successful when administered as quickly as possible, but you must first determine if it's necessary. It should only be performed when a person isn't breathing or circulating blood adequately. First, you need to determine that it's safe to approach the person in trouble. For instance, if someone is injured in an accident on a busy highway, you'd have to be extremely careful about ongoing traffic as you try to help. Or if someone touched an exposed wire and was electrocuted, you'd have to be certain that he or she is no longer in contact with electricity before offering assistance to prevent becoming electrocuted yourself. Once you know that you can safely approach someone who needs help, quickly evaluate whether the person is responsive. Look for things such as eye-opening, sounds of the mouth, or offer other sounds of lifelike movements, such as arms and legs. In younger kids and infants, rubbing of the chest can help determine if there is any level of responsiveness. In older kids and adults, this can also be done by gently shaking the shoulders and asking if they're all right. The next step is to check if the victim is breathing. You can determine this by watching the chest for the rise and fall of the chest to come up and down, and listening for the sounds of air going in and out of the chest, or the mouth, or the nose. In a CPR, a basic life support course, participants practice techniques for determining if breathing or circulation is adequate. If you can't determine whether someone is breathing, you should begin CPR and continue until help arrives. Whenever CPR is needed, remember to call for emergency medical assistance. CPR courses teach you that if you are alone with an unresponsive infant or a child, give chest compressions for 5 cycles, which is about 2 minutes, before calling for help. According to the BLS for healthcare providers, the 3 basic parts for CPR are easily remembered as ABC. A is for airway, B is for breathing, and C is for circulation. A is for airway. The victim's airway must be open for breathing to be restored. The airway must be blocked when someone loses consciousness or may be obstructed by food or another foreign object. In a CPR course, participants learn how to open the airway and position the person so the airway is ready for rescue breathing. The course will include what to do to clear the airway for you if you believe an infant or a child has choked and the airway is blocked. B is for breathing. Rescue breathing is begun when a person isn't breathing. Someone performs rescue breathing, essentially breathes for the victim by forcing air into the lungs. This procedure includes breathing into the victim's mouth at correct intervals and checks for signs of life. A CPR course will review correct techniques and procedures for rescuers to position themselves to give mouth-to-mouth resuscitation to infants, kids, and adults. And C is for circulation. Chest compressions can sometimes restore circulation. 2 rescue breaths should be provided, followed immediately by 30 chest compressions. This cycle by 2 rescue breaths and 30 chest compressions is repeated 5 times in an infant or a child with a collapse prior to calling for help. This cycle is immediately resumed and continued until the child recovers or help arrives. It is not necessary to check for signs of circulation to perform this technique. This procedure involves pushing on the chest to help circulate blood and maintain blood flow to the organs. A CPR course will teach you how to perform chest compressions in infants, kids, and adults, and how to coordinate the chest compressions with rescue breathing. Nearby hospitals and your local chapters of the American Heart Associations and the American Red Cross are good sources for finding CPR courses in your area. There are many places that you can find CPR courses in your area. It is important that you get a certificate from the American Red Cross. When taking the course, be prepared to learn a lot to take the class seriously. Qualified instructors may use videos, printed materials, and demonstrations on mannequins representing infants, children, and adults to teach proper techniques on performing CPR. The AHA's Basic Life Supports course that includes CPR lasts about 3 hours and takes place with 1 session. The course covers adults and child and infant CPR choking. Participants practice the techniques on mannequins and can ask questions and get individualized instructions. The final test of the course is a combination on demonstration, CPR skills, and a written test. CPR is a skill that must be practiced. It is wise to repeat this course every 2 years to maintain your skills. Doing so allows you to learn about any new advances or discoveries in CPR techniques. Remember, taking a CPR course could help save you, a child, or someone else's life someday. And these are what I was going to show you. This is just to help save your mouth to protect you from kissing somebody else, basically. And this is the one for the child, and this is for an adult. And that's all. Thank you.